Thank you very much, Chairman Bost, and thank the witnesses for being here. It's a little bit surreal to me because I started out my career as a second lieutenant nurse in the Army stationed at Walter Reed on Ward 10, the neurosurgery floor, so taking care of traumatic brain injuries, which we didn't call them that at the time, spinal cord injuries. I've flipped my share of striker frames and also worked with halos. And my husband, interestingly enough, got out of the military to get his BSN. He was an E6 LPN when we met and took care of a spinal cord injured veteran as a private LPN to do that before the VA provided that care. So I know how challenging this can be. Dr. Scavella, according to some of the data obtained by committee staff, we know that 18% of patients seen in the past 3 years for spinal cord injuries and disorders were also seen for substance use disorder or had that diagnosis. Do you believe that the VA has the capacity to provide inpatient mental health and substance use disorder care?
Yeah, so Dr. Miller-Meeks, thank you for that question. We do feel as if we have that ability because we are an integrated healthcare system. Mental health is embedded in the patient-aligned care teams that provide primary care for this population of veterans. If they require substance use disorder on an inpatient setting, we are able to provide that care as well. We do have systems across the services across the system.
Are the SC, and this is again reminiscent of the old Walter Reed, are the SCID units using 4-patient bed models in their centers? And do you believe that having 4 patients in a room is appropriate for minimizing risk of infection and creating a healing environment?
Yeah, so Congresswoman Miller-Meeks, thank you for that question. We have older facilities, as you just reminded us of, that do have 4 beds in some rooms. We are constructing facilities that do not have that configuration. So our goal is to try to reduce the size of the rooms to make sure that we're giving patients the privacy, both from a mental capacity and from a healthcare capacity. So that is not the standard at this point in construction. When and where possible, we will not use all 4 beds in a room to make sure that we are giving patients the privacy that they require.
Thank you. And just to follow up on Representative Takano's question, what are the main barriers, and you may have answered this, to staffing SCID centers as opposed to other VA medical facilities?
Yes, so thank you for that question. We understand that this is a highly skilled area, as you just mentioned during your experience. These veterans require lots of care, lots of patience, and so it takes a certain type of clinician or professional to be a provider of that care. So making sure that we recruit, retain the highest skilled employees in those areas is really important. We want to make sure that they have the highest quality, and so we review that on a regular basis through our ongoing professional practice evaluation. And we also want to make sure that once we bring them in, that we're giving them the tools to grow as professionals to make sure that they stay with us and continue to serve veterans.
I would say it was some of the most rewarding medical care as a nurse or a doctor that I'd ever administered.